Hello, and welcome to Your Health Equity Matters. I'm Elgloria Harrison. I'm the Dean for the School of Health Science, Human Services, and Nursing. And I'm thrilled to launch this podcast where we explore health topics that matter to our community with a special focus on equity. Today, we're diving into RSV, influenza, COVID 19, and asthma. And we're also going to talk about vaccines as a powerful tool in our prevention toolkit. You know, millions of Americans and people all over the world actually are subject to get sick from the flu, RSV every year. And now we can even add COVID 19 to our toolkit or to our list of issues that people get. Some people are hit harder by these, like babies that are 6 months and under, and those that are 75 years and older. I recently learned that here in the state of New York, we're going to be expecting one of the worst flu RSV seasons than we've had in the past. So it's important that we protect ourselves, which means getting a RSV, flu, and COVID 19 vaccine. And we're going to talk about that during this time that we're going to spend with you today. To help us dive into this topic, I'm joined by Dr. Natasha Nurse Clark, professor and chair in the Department of Nursing here at Lehman College, and Dr. Darcel Reyes, associate professor and deputy chair from the Department of Nursing here at Lehman. Ladies, welcome to our episode of Your Health Equity Matters. Dr. Natasha Nurse Clark has been a registered nurse since 2005. And with her 20 years of experience in maternal and child health and health disparities research, we're so pleased that she is a trusted voice here in our healthcare system. Dr. Darcel Reyes has been a registered nurse for over 30 years and has practiced as an adult nurse practitioner since 2007, serving mainly patients with HIV. So another trusted voice in our healthcare system. Thank you both for being a part of this episode. I'm excited to hear your insights. We're going to start talking about RSV, influenza, another name for flu, COVID 19, and asthma. And as such, these are very, very important healthcare topics and how they impact our community. So let's start off with what is RSV, and then we'll go to what is the flu and COVID 19.
Sure, and I'll start talking a little bit about RSV. So RSV stands for respiratory syncytial virus, and it's also something I wasn't all that familiar with, but in my background working in the neonatal intensive care unit is where I started to learn more about RSV and seeing mostly a lot of children, babies, infants coming in with RSV and very severe symptoms. So one of the things that I want to make sure that people are aware of is RSV is something that can be common, many times presents as a common cold for older kids and children. However, in certain vulnerable populations, babies, newborns, or even older adults, it can present much more severely. So we want to make sure that we're taking it very seriously. Also, we want to be aware of the way that it can present. And we might notice things like a sniffle, a cough, but in small babies, you may see things like breathing very fast, or maybe your baby's not eating very well. And these are subtle signs, but they're very important to be aware of because it can lead to very, very serious symptoms. And because babies and older adults sometimes cannot mount the type of response that older children and adults can mount, they're not able to defend themselves against these types of viruses. So it's very important to remember things like prevention. And even though it's tempting to go in there and squeeze a baby's cheeks or cuddle with them or coo with them, We have to remember things like hand washing, very vigorous hand washing. We want to be sure that we are staying a safe distance if we ourselves have a cold or a cough, because babies are very, very, they can catch these very, very quickly, and we can spread them without even knowing that we ourselves are sick because we may not have symptoms, and then this child or older adult may be getting it.
Thank you so much for that. That was really good. Now, what is the difference between RSV and influenza?
It's really, really hard to tell the difference. But before I go on, I just want to mention that I recently read that 2 out of 3 babies will get RSV by age 1. So that's very significant and important for parents to pay attention to. Now, the differences between RSV and flu are very difficult to differentiate. But someone with flu will feel a lot sicker than somebody with RSV. A person with flu will probably have a higher temperature. With RSV, it might be a low grade, might not even feel like they have a temperature, but with flu, you will. There'll be a lot more feelings of fatigue and exhaustion. For some people and some children, there may be nausea, vomiting, and diarrhea with flu. So that's one of the main differences that you'll be able to differentiate. If you're much sicker, it's probably flu. And that's where vaccines become important. With someone who's older with a chronic illness, especially a breathing-related illness, there will be more shortness of breath. There'll be more difficulty breathing. There'll be more feelings with flu of, this congestion, like I can't breathe. So those are things to pay attention to.
And now that we've all experienced what it was like to have to be in the world with COVID-19, and now COVID-19 is it's what we called an epidemic now, as opposed to a pandemic when we actually learned those new terms, pandemic and epidemic. So now we have to actually be concerned about COVID-19. We recognize that right here in the Bronx, COVID-19 really was pretty devastating to many of our communities here. And so, doctors now are saying that if you're in a certain population of older adults, you really need to be very concerned about COVID-19.
Okay.
How would you think we would differentiate that from the flu? I certainly know that older adults can also get RSV. So now we got these 3 respiratory conditions. And so, I'm at home like, do I have RSV? Do I have flu? Do I have COVID-19? How would we think about that?
Yeah. I think one of the good things that has happened in response to COVID is it is a lot more accessible. You can pick up a kit to test for COVID-19 very easily. So I think even if it passes through your mind, if you're wondering, I'm not feeling so great, I wonder what's going on, maybe you don't feel like you want to go to an urgent care or an emergency room or even make an appointment with your doctor, you can very quickly go into a pharmacy, a local area to pick up a test so that you can rule that out. Because as Dr. Reyes says, the symptoms are so similar. It can be very difficult to differentiate. So if you feel mild symptoms but you want to get checked, you can very easily pick up a COVID test. Now, if you are feeling symptoms where you're like, something is wrong, I'm really tired, I'm a little achy, I'm not feeling well. When you get to that point where you really are feeling, below your standard, below your average, I would definitely recommend going in to see your doctor, whether it's your primary care doctor. If you're really not feeling well and cannot get an appointment, you can try an urgent care or even a local pharmacy where they do things like a minute clinic where you can get some advice. But it's very important to act on those feelings. I can't stress how much sometimes people wait when they're having symptoms and they continue to get worse. And to you, you may not recognize that it's getting really bad because it's getting maybe a little bit worse, but you may get to a point where you're doing damage that could have been corrected if it was addressed earlier. So mild symptoms, sometimes you can get an over-the-counter test or even over-the-counter cough medicine, but if your symptoms are not getting better, I would urge you see your local provider, go to a minute clinic, get some advice from somebody that may know what's going on, because it's very difficult for you as an individual to be able to differentiate.
Ah.
But what's great about if you go to your provider is that there's a test where you just, with one swab, they can differentiate whether it's RSV, flu, or COVID. So it's not like you have to get 3 tests. It's just one quick swab. And the results come in hours. Because I know that, when I've had patients come in with the symptoms and they can't differentiate, and I have suspicions that it may be COVID, but I'm not sure. When I give that test, within hours I can call them right back and say, hey, this turns out to be RSV. Just take care of yourself, stay home, rest, drink plenty of fluids, take a mild Tylenol or something like that, and rest. Or it's flu, and I'm going to send this prescription for you. Pick this up. So it's just so much easier now to differentiate and take care of people.
Very true.
I'm so glad that you said that it's so much easier now. Because, years ago it was much more difficult, right? Let's turn our attention a little bit to asthma. While RSV and the flu and COVID-19 now are really top topics, it impacts people that have asthma really, really badly. And certainly I'm a respiratory therapist, so of course, like you, I've had the opportunity to work with patients that have lots of problems with their breathing. So asthma is one of those things that we really want to have people to understand that it's not something to play with,
Right.
particularly when you're babies or children, or even when you're older adults. A lot of times, older adults don't recognize that they may, in fact, have asthma because they might interpret that as something else, right? And so we want to really talk about that. So first of all, let's just say, what is asthma? And asthma really is a chronic condition. It's a chronic disease of the inflammation of the airway. And actually today I was going to bring a model of what that asthma looks like. Narrowing of the airway. Some of the traditional symptoms are going to be things like shortness of breath, my chest is very tight, wheezing, which is your typical, symptoms, coughing, actually.
Yeah.
And in fact, in little children, coughing is usually your number one symptom of whether or not a child has something like asthma. I remember when I practiced early, we never said to parents, your child has asthma, because there is a way of making sure that a child has asthma. And the gold standard had been always to go into the pulmonary lab and do a blow into to make sure that the numbers that they see are actually. And so for little kids, we say that, we have what is called probable asthma, and so lots of those things. But we know that in New York in 2024, 1.5 million adults and 400,000 children actually had asthma. These were confirmed diagnosed cases. That's a lot.
Yeah.
And so we really would be careful because, they are the ideal people, right, that would actually be subject to RSV, flu, and COVID-19.
Absolutely.
Right.
And so those are the kind of things. So some of the things that you just said about what they need to do to take care of themselves, it's really important for our patients to know that these are very simple things that we can actually do.
Right.
But we don't want to take it for granted that, I'm going to get better in another day or so, or I don't have my inhaler. Those are the kind of things that we really want to encourage people to really do. Let's turn our attention now to vaccines. There's a lot of discussion about vaccines and what it is and why we should use it or not use it and things like that. And of course, I want to be careful to say, taking a vaccine is a choice. That is a choice that
Absolutely.
you can do. But we're here to talk about what vaccines are and why I think you should add that to your prevention toolkit. So vaccines are weakened or dead versions of the virus or bacteria and from some parts of the germ. and they are designed to help boost the immune system so that the immune system can really punch out that whatever that bacteria or virus is, and that really is what it is, and so some people would say, oh, well, I took my flu shot and now I got the flu, and of course some doctors will say, and some healthcare providers will say, well, if you didn't take the vaccine shot, you really would feel bad right about now. So it's not that the vaccine gave you the flu.
Right.
It's that it kind of energized the immune system. So the energy of the immune system now is kind of revved up so that they can actually really fight off the disease, and that really is the goal.
Exactly. I think that when you've illustrated it so well here, but I think when people hear, I'm going to boost my immune system, I'm not going to get sick, the automatic thing that people think is, I'm not going to get sick, I'm not going to have symptoms. So when you start to feel symptoms, you're like, well, that vaccine didn't work, or, it made me sick. But I think we need to reframe some of that understanding. What it means when your immune system is boosted, it's going to react as if you may have that particular virus or disease. You don't have it, but your body is going to react as if it did. That is perfectly normal. That is exactly the way it is designed to respond. That is the powerful nature of a vaccine, to be able to mount a response to something that you don't have so that the next time your body sees this, it recognizes it and it knows how to address this issue. So I think we need to reframe a little bit of how vaccines work so that people understand just because you may have a symptom and feel like you may actually have the flu or COVID or something else, it doesn't mean that you have it. It does not mean that the vaccine is causing it. Your body is doing exactly what it was designed to do.
Well, I have a little story about that.
I'd love to hear it.
When I got my COVID vaccine, the next day, I was feeling a little achy. I was feeling exhausted. And, I had a little bit of irritation at that site. It hurt and it was red and all of that. And I was like, oh, my goodness, what's going on here? And I'm a healthcare provider. So, when you're a healthcare provider, don't diagnose yourself. So I went to the physician that I was working with. And I was like, well, look at this. I'm all swollen. I feel achy and all that. He says, you know what that means? And I said, what? He said, that means that you've got a really strong immune system. And your immune system is kicking in and activating and preventing you from getting the disease.
Right.
So I was, really happy about that. And of course, I knew that. But hey, that's the way, And it just reminded me of, when I took my children to get their vaccines, the first thing the pediatrician said to me after he gave the baby the vaccine was, now the baby might have a little mild fever, just give them a little liquid Tylenol and they'll be okay. It's the same thing.
Yes.
My little babies were... Their immune systems were intact. They were working. Right. So was mine.
Right.
So that's something to remember when you think it makes you sick. It just means your immune system is working. Exactly. It's punching out, as Dr. Harrison said.
Exactly.
This is so cool, right? Some evidence and some research that I did, and it says RSV leads to 3.6 to 6.5 million outpatient visits and almost 300,000 hospitalizations.
Right,
that is really. So I think, some of these opportunities for us to share with our community, there are some simple things that you can do to kind of avoid being in there. Just during the week of November 8th for the state of New York, there was 2,400 cases of flu. 2,028 cases of COVID-19, and then 1,040 cases of RSV. That's just in November or November 8th. Right. So we really want our community to know there are many, many ways of preventing some of these occurrences. And so we are here to just make sure that you understand that vaccines are safe, particularly the vaccines that have been tested over many, many years. Yeah. Again, we will say, vaccines are a choice, but we believe that is one of the choices that should actually be inside of your prevention toolkit.
Yes.
So one of the things that we really want to say is, why does all of this matter?
Right.
This matters because your health is so important. Your health equity does matter, and it matters because there are many among us that are, that have respiratory conditions, that have chronic conditions, and they're subject to these kinds of conditions. And while we don't oftentimes think about these kinds of conditions, we do need to know that those among us that are more vulnerable. We also just need to know that these respiratory conditions are spread by droplets. So even if you're just speaking, as Dr. Nurse Clark said, you might have a little when you're talking and you're so excited, and particularly for babies, that saliva you might get on them on their little cheek will actually spread very, very quickly.
Yes, absolutely.
Really. And so for those that are under 6 months of age, and those particularly over 75 years old, and many of us have parents that are still alive with us, and they are, so we want to be very careful that those in that particular age group are many, many of the most vulnerables among us.
Right.
We also want to talk about those that have chronic conditions, like COPD or chronic obstructive pulmonary disease or bronchitis or cardiovascular disease. There are lots of people with all types of conditions that subject them to be very carefully to watch many of those. All right. And then I think what we want to talk about, We've mentioned a lot of these things inside of our little discussion, but let's hone in. What are some preventions? Let's just talk about that. What do we say to our audience today that we need to have them to know that they can actually prevent some of these things from happening? Anybody?
Right. I think we've spent a bit of time talking about vulnerable populations and why it's so important to intervene early. Prevention, vaccines, especially for very young children, older adults. But there's also a community responsibility as well. So whether or not you're vulnerable, whether or not you're in one of the categories that we talked about, maybe you have asthma, maybe you have bronchitis, maybe you have something else, a chronic condition, whether or not there is a community responsibility, because you may have something and either it's very mild, you're not too worried about it, you're still going to work, you're still out in the community, but somebody else may be particularly vulnerable.
Right.
So we all have a responsibility to be engaged in prevention. And what does prevention look like, right? We touched a little bit on it in terms of things like hand washing or maybe staying a safe distance away. But it's also things like if you have some type of symptoms, you want to be responsible about that, right? Obviously, you're not going to visit anyone in a hospital or in a nursing home or something like that. But if you do have to be in public, try to stay a safe distance from others. Wear a mask if you know you have some type of a cold or a cough. And also vaccinating yourself helps to protect others as well. So it's not just, oh, well, I'm healthy, I never get sick, but you may pass something on to someone else. So also getting vaccinated is a community responsibility as well.
It is, absolutely. Absolutely. The other thing I would just remind, hand washing, absolutely the most important thing people could do. If you don't have a mask, remember the way to protect others when you cough is to put your arm across your face and cough into your elbow. That way you keep the germs off your hands so that you don't expose and touch things. So that's also very important. And I would also like to think, when you talk about groups that may not have a chronic disease or may not fit into those populations, here in the Bronx, there are many people who are living in communities where there's high levels of pollution. So that's something to think about, too, when you're interacting or in those communities, that people living in those communities are already at high risk because of the community that they live in. The other thing that I want to mention, because I have an interest in climate change and what's going on there, is that when we have extremes of heat, when we have extremes of cold weather and storms, all of these individuals in vulnerable communities are going to be sicker and more endangered. So again, vaccinate yourself to protect them. And if you know people living in those communities, spread what you've learned today to them so they know how to protect themselves when they're in those situations, especially those people with asthma.
Right,
Right?
absolutely.
Share that information with them so that they can protect themselves.
And I will say just one more thing about asthma, and certainly for those families that are diagnosed or have a diagnosis with asthma, or even feel like, they have a lot of the same symptoms that asthma patients will actually display, that having an asthma action plan is really very important.
Right.
An asthma action plan really helps them to really kind of keep up with whether or not their asthma is in control. A lot of times we have our inhalers, and inhalers are very good because inhalers do one major thing, and that is open up the airway so you can feel like you can breathe. But most of our healthcare providers would say if you really have asthma that is not in control, then the bronchodilators are not the only thing that you need to be taken. And so we do want to encourage anyone that feels strongly that they've got to do their inhalers on a number of occasions, more than twice in a day, more than waking up, more than 2 times at night. All of those kinds of things are going to help us to know that perhaps maybe I need to actually talk with my healthcare provider about. Now, when you go to the healthcare provider, this is what I always say. I have to remind myself to ask the questions.
Can I?
Yes.
Can I just add to that?
Yeah.
There is a little technique called Ask Me 3. And that is another thing that everybody should learn. To ask your provider 3 questions. What is my problem? What do I need to do about it? And how do I know that it works? Just those 3 questions. I mean, I would give those to my patients on a piece of paper when they went to another, like a pulmonologist, a lung doctor, so that they could write down what the doctor said and read it and be aware of it. But just those 3 questions. What is my problem? What do I need to do about it? And how do I know it works? Perfect questions to get all your healthcare questions answered.
Yeah. And it's a good idea to write that down because we get into the doctor's office and you're so focused on, what's going on or you're not feeling well and it may go right out of your head.
Absolutely.
Keep those questions
Just those
with
3.
you.
Right. Keep them with you.
Yeah.
All right. So remember, vaccines are an essential tool in your prevention toolkit. Keeping them up to date helps you to protect you. It protects your family and your community. I want to thank my 2 guests, Dr. Natasha Nurse Clark and Dr. Darcel Reyes, for sharing their insights today with us. Thank you for joining us on this episode of Your Health Equity Matters. Next time, we'll explore hypertension, high blood pressure for those, and that is, we certainly know in the Black community, it's called the silent killer. Till then, I want you to stay healthy, stay informed, and we'll see you next time.
Thank you. Thank you for this opportunity.
Thank you.